Hi there. I know, I know. You all have been clamoring for my return. And this little preface to the video is my apology. My apology video, yeah, okay, well. I'm sorry. I always say that I'm back, and it's never the case. These past few months have been difficult, and it's been difficult to be able to sit down and make a video. So, from the bottom of my heart, I'm sorry. Now, I'm not saying that again. What I said in the last video, oh, I'm back for good now. No, we're not doing that anymore. Okay, in fact, I'm actually saying the exact opposite. I am not done. Let's get it out there. I am not giving this up. This is my dream. No, we're not giving this up. It will be a while until the next video, and there's a very good reason for that. I'm moving. Yeah, I know. This space, it's already been a year in this place, and I'm already done. I'm moving to something a lot more permanent, so hopefully we don't have to do this again. But I'm currently in the process of moving, so I need to not make videos for a while. So just so we all know, it's going to be a while. Now, I made this cranial nerve exam for you because it's what everybody wants, and I'm not going to go any longer without at least something out there. And thank you, by the way. Thank you for sticking with me. I read every comment I get, the good and the bad. I read every single comment I get. And from the bottom of my heart, thank you for staying there and sticking with me, because it really does mean a lot. Well, enough rambling from me. Here's me. Please enjoy the video. Oh yeah, my hair's gone. Probably should have started with that, shouldn't I have? Anyways, please enjoy. Come in. Take a seat. How you doing today? Good. Yeah, we've actually met before. I'm Dr. Ash. Yeah, you probably don't recognize me with the haircut. I know. We get it all the time. But yeah. So I was just looking over your chart. You are my 6 o'clock, right? Yeah. Okay. So just looking over your chart. Looks like it's been quite a while since your last cranial nerve exam. Is that right? Yeah. Okay. So, well, if it's all right with you, we're just gonna go through everything then, if that's okay. Great. So, I'm just gonna start with kind of just get your name for formality's sake. Yeah. Okay. What's your date of birth? And has your address changed since your last visit? It has? What's your new address? Could you spell that for me? Thank you. And is your phone number or email changed? No? Okay. It's okay there. And we don't necessarily have to go through the entirety of the family history, but has anything since your last appointment, has anything in your family history changed, or anything in your history changed? No. Okay. That's good. Well, we're just going to go ahead and get started. I'd like to start with the mental acuity test now. This is just going to be a couple of questions. Some are more difficult than others, and I just answer them to the best of your ability, okay? Okay. So, what is today's date? Good. Apologies for all the background noise. And What is the day of the week? Good. And what is, let's see here. What's the month? Well, I suppose you've already answered that, haven't you? What year is it? I'm going to give you 3 words, and I just want you to repeat them at me, and then I'm going to ask you to repeat them again later, okay? All right. I'm going to go with ashes, chair, and cucumber. Repeat this for me. Yeah, I know, little shameless plug there, I know. Yeah. Ashes, chair, and cucumber. Good, okay. Keep those in your mind. I'm going to ask you to repeat those in a little bit, okay? All right. So, I'd like you to take the number 100 and subtract 7 from it. Good. 7 from that. 7 from that. One more time. 7 from that. You can stop there. That's perfect. That's all great. The nurse got your vitals and everything, right? Blood pressure, heart rate, everything. Okay. So to make sure. That wasn't part of the mental acuity test. I was genuinely making sure. All right. So let's see here. So screwdriver, hammer, and nails. What are that? What are they? Tools, things used for building. Yeah, tools is fine. And apple, banana, peach. What are those? Fruit. Very good. Okay. That's perfect. Give me one topic that's going on in the news right now. It could be anything you want, just a topic, a current event topic. It's good, yeah. Checking over the test here. You got those 3 words, right? Good. Okay. Tell me, what's your favorite meal? Good. And can you tell me when the last time you had that was? Yeah, I know it's been a while since I've had my favorite meal too, but just best guess is fine. Actually, that sounds pretty good. I'm a big food guy, so yeah, you know, I was always a picky eater, but if I found something I liked, man, did I like it. Okay. And what I want you to do is I'd like you to take, switch to a blank page here. Here we go. Take this pen and write just a complete sentence for me. It could be any sentence you want, just a complete sentence. Okay. You should like this video and subscribe to Ash McClure ASMR. That's good. That's a good sentence. Okay, I like that sentence very much. Okay. So, what were those 3 words I asked you to remember? Ashes, chair, cucumber. You got it. That's perfect. That is it for the mental acuity test. Fantastic job. I'm actually done with this clipboard for now. We're going to move right on over to the meat and potatoes, the cranial nerve exam. Yeah, I know, that's actually not part of the cranial nerve exam. Apologies for all the traffic outside. So, you said the nurse got your vitals, so I'm just going to start off real simple with the olfactory nerve test, or testing your sense of smell. What I'd like you to do is I've actually got a little perfume here. And this is Just well, I actually can't tell you what it smells like, but you can see it's in a nondescript bottle, no label or anything, no cues as to what it is. And what I want you to do is I just want you to let me know what it smells like. Okay, you don't have to close your eyes because obviously, as you can see, there's nothing on it. It's been a while since I used this, I guess. What does that smell like? Yeah, you got it. It's coffee. That's very good. Sorry, now the whole room smells like coffee. Yeah. Well, I'm glad you like the smell, but actually, not my favorite. I know. And I've got a different one here. Now, I ask you to close your eyes for this one, please, because this one does have things on the label. What's that one? Strawberry. Very good. And I just want to test your sense of taste. I kind of do them together, just makes things a little easier for me. And for this, get this little dropper bottle. Again, as you can see, nondescript. You don't have to close your eyes or anything. I'm just going. It's a bit of flavored water here, and it's flavored, obviously, but it's water, so you can't tell what it is. And I just want you to let me know what it tastes like, okay? So go ahead and stick your tongue out for me. Go ahead and stick your tongue out, stick your tongue out. What does that taste like? Something sweet, like chocolate. Close enough, yeah. The fact that you got that it was sweet is good enough for me. It's actually not chocolate, but the fact that you got that it was sweet is a sign that your sense of taste is working. So that's fantastic. Great job. We're gonna move right on over to your eyes, and we're just gonna go ahead and start with the chart up there, as you can see. Just a standard Snellen chart. And I just want you to let me know what that is. Easy one. E. Yeah, absolutely. And we're just going to jump around a little bit here. I think you're okay there. What's that letter there? Yeah? Good. Good. Okay. And we're going to jump a couple lines. We're going to come down to line 6. Good. Jumping down to line 8 now. If you can't see this, that's okay. What is that one there? Okay. And this one? Good. Spot on. That means you are 2020. Congratulations. For extra credit, bottom line. You can't see that. Perfectly understandable. What color is that? Good. And that one. Green and red. That's fantastic. Spot on. So, excuse me. I want to have a look at your pupils now. You'll have to excuse my dying flashlight. Obviously, needs a battery change, but go ahead and stare at the wall behind me. Okay, that's good. Just checking your pupils. I'll have to change the battery in this light for certain. Checking for. This is called the swinging light test. Yeah, it checks for a relevant pupillary defect, and you're good there. You're perfectly fine. Okay. I'd like to have a look at the back of your eyes. For that, I have this different flashlight that doesn't actually need a battery change, and this has a little magnifying glass on it. And what I want you to do is blink anytime you need to, but keep staring at the wall behind me. Okay. Get real close. Is it alright if I come close? Thank you. Okay, that's good. Now what I want you to do is I want you to look up for me. Okay, good. Now look down. Again, blink anytime you need to. Just don't forget to blink. Okay, now look to the left. And look right. And look straight back at the wall again. Thank you. Give you a second. I know this having this light shine that close to your eye can be a little uncomfortable, but you didn't experience any pain or anything like that, did you? Good. Okay. Ready? Okay. Okay. Remember to blink anytime you need to. Okay. Great job. Have you noticed any issues with your hearing? No. Okay. Well, I'm going to bust out my handy dandy tuning fork. Guess we'll get a nice bass line here. Can you hear this? And this? Okay. Let me know when this stops. There? Okay. Let me know when this stops. There. Okay. So this is a 128 hertz. Excuse me. 128 hertz tuning fork. Apologies. And what I'm going to do is I'm going to strike this. I'm going to put it on the bone behind your ear. So right back there, okay? And I just want you to let me know when you can't hear it anymore, all right? Okay, ready? Okay, let me know when you can't hear it anymore. Okay, can you hear it there? Yeah, that's good. And we'll do the other side, same thing, all right? Yeah, that's working. Okay, can you hear it there? That's good, okay. Let me know, close your eyes, and let me know what side you hear this on, okay? Middle, okay. Good. Good, okay. You can open your eyes. Actually, sorry, leave them closed, please. Can you hear that? Let me know when you can't hear it anymore. Good. Keep those eyes closed. Let me know when you can't hear it anymore. Great. That's amazing. Such a good job. You're doing fantastic. You really are. Put that away for now. All done with the tuning fork. I'm going to whisper a number in your ear, and I just want you to let me know what number I say, okay? All right. 99. Okay. 100. Good, okay. One more time. 64. 86. Great. Amazing job. Let's move on to your sense of touch. Now what I have here is a very soft and clean, obviously, very soft makeup brush. If you just hold out your hand, I can show you. No sensation of pain with that, obviously, right? Good, okay. Close your eyes. Let me know what part of your face I'm touching, okay? All right. Good. Good. Great. Good. Good job. And one more time. Nose. That's good. Okay. Very good. This is, as you can see, this is the stick I use for the Snellen chart. But as you can see, there's a little bit of more of a point there and more of a rounded point on this side. You can actually feel the difference if you hold out your hand. That's sharp and that's dull. Got it? Close your eyes. Let me know if you feel sharp or dull, okay? So just say which one it is. Close your eyes. Good. 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 Great job. That's fantastic. Alright, that's really great. Okay, we're just going to do a quick test of your motor function and your reflexes, and then you'll be good to go. Alright. It's great to see you again, by the way. I didn't mention it at the beginning. Fantastic to have you back in the clinic. All right. So, what I want you to do, excuse me, I would like you to tilt your head all the way back for me, all the way back, and all the way forward to your chest, all the way to that side, and all the way to that side, as far as it'll go without being painful. Great. Any issues with that at all? No. Okay. What I'd like you to do. Stick your tongue out for me. Move them side to side. Good, okay. Smile for me. Real big, show your teeth. Great. And make a frown for me. That's good, but really far, really accentuate those neck bones. See how mine goes? Yeah, really do it. Yeah, that's good. Okay, clench your jaw for me. Okay, let me open it. Right now. Open up your mouth. Don't let me close it. Okay, that's good. And Any issues with that at all? No. Okay. Do you want to chomp? Give it a little chomp. Good. Okay. And move your jaw from side to side. Not too much, obviously. You don't want to hurt it. That's good. Okay. Any issues with that? No. Fantastic. Any issues with like mouth ulcers or anything like that? No. Good. That's good. Good to hear. Any issues with talking or chewing? No? Good. Actually, that could actually be an issue with your ears also. Oddly enough, the ear connects to more than we think. It controls balance. Any issues with your balance at all? No? Great. It connects to your jaw, things like that. So when you feel your ears pop, sometimes it could be called like talking or chewing, which is interesting, isn't it? Okay. So I want you to raise your eyebrows just like that for me. Yep, that's good. Okay. Good. Scrunch up your eyes like you've got soap in them. Okay. Don't let me open them. Good. Okay. We'll move on to your hands. Actually, before that, showing your shoulders. Yep, just as high as they'll go. Don't let me push them down. Good. Move your hands up just like this, like you've got a board. That's good. All right. Let's see if I've got a bit of paper I can put on that. Maybe in here. Yeah, here you go. Just put that piece of paper between your fingers for me. Don't good. Okay. Don't let me pull back. Good. Okay. That's good. Very good. Fantastic job. Let's move on to some of the muscles in your hands. I'm just gonna. Do you mind holding your hands over me? Thank you. I'm just gonna check all the muscles in them. Just give it a nice feel. Checking your nails, good circulation coming through there. That's fantastic. Any issues with your hands at all? Any numbness or anything like that? No. Okay. What I want you to do is like you to clench some fists for me. Yep, up like that. Yep. Don't let me open up that fist. Don't let me open up that fist. That's good. And what I want you to do is keep that position, but push your arm out. Okay, good. Now same position. Pull it in. Good. Fantastic. Good strength there. Do some more things with your fingers. What I want you to do is like make a circle like that for me. And don't let me break the circle. Good, that's good. Don't let me break the circle. That's good. Okay, don't let me break the circle. Don't let me break the circle. Okay, good. Don't let me break the circle. Good. Don't let me break that. Don't let me break that. Good. Okay. Kind of do this for me. Just like this right there on that knuckle. Yep. Other hand. I know I actually can't do it that fast. I'm not very good at it, but you're doing great. That's fantastic. What I want you to do is right there on your leg. I'd like you to pretend like this is your leg. I just want you to go like this, okay? Right down on your knee there. Good, okay. Other side. That's fantastic. Make your hands as stiff as like they can get. Like that. Don't let me bend them. Don't let me bend them. Good. It's very good. Sorry about that. That seems to be good with your hands. I would just like to check your reflexes and you'll be good to go. Got the handy dandy reflex hammer here. So what I want you to do is just stay nice and relaxed. All right, nice and relaxed. Let me do the work here, and you just relax. Okay, all right. Checking your arms here. That's good. Moving down to your legs, kind of back up a little bit, so just so your legs are dangling. Thank you, appreciate that. Good. It's good. Checking your ankles here, and you're good to go. Yep, you're all done. I will forward your information on to the other doctors, but I have to say that there really wasn't many issues. Actually, I don't think there was a single issue. But obviously, they want to go over it, do their little checklist. So, I think you did great. Yeah. It really is nice to have you back in the clinic. And I hope to see you sooner rather than later. Yes, it's an absolute honor to have you back. You have a good one now.